If you ever need a life-saving air ambulance, the cost may be something that's not on your mind, but being unprepared can have expensive consequences. In this video, I'll break down everything that you need to know so that you're ready for anything. Factors that influence medical evacuation costs. Areas in which costs can escalate in a medical evacuation can be when we have to add designated specialty physicians or flight physicians on a mission, as well as specialty transports such as a neonatal intensive care unit team or an ECMO transport team. Additionally, there are life-saving drugs that are on board every aircraft, but there are circumstances in which we have to use medications or advanced treatments. Of course, the distance on where we are flying to obviously impacts costs. The amount of fuel, our landing fees, our customs and immigration fees, our ground ambulance on both pickup and drop off, because REVA is a bedside to bedside service. So we're arranging ground transports on both ends. Mileage there, the amount of time on the ground can all increase the cost of an air ambulance. Does insurance cover medical evacuation? Yes. There are circumstances in which insurance does cover medical evacuations. When we talk about insurances, there's multiple types of insurance, whether we have our commercial insurance companies here in the United States that we deal with on a daily basis, or are we talking about our travel insurance or travel assistance companies. There are multiple ways that an air ambulance can be paid for, which is why internally we have a team that's dedicated solely to making sure that we advocate for every single patient that we encounter to alleviate these spills. So standalone medical evacuation plans is also a great policy that you can purchase that will cover anybody who is stuck abroad. I always recommend that personally to family, friends, anybody who begins to talk about this type of scenario, because this will cover you and get you out of a situation in which you are desperately in need to get out and get back home to the United States or Europe or North America, wherever we're going. I personally recommend anybody to take out a policy whenever they travel, regardless of where they are traveling, because the way I look at it is you're spending a small amount of money that provides a sense of security, so that in the event that the worst does happen, there is less stress involved, that it's simply just picking up a phone and someone coming to get you. I never travel without travel insurance of some sort because it is a peace of mind. Although I may not utilize it, having that sense of comfort makes me feel more comfortable when I'm abroad. Travel coverage, whether you're doing it annually or per trip, you're talking hundreds versus thousands of dollars for an air ambulance. So if you have an emergency when you're abroad, the first thing you need to do is you need to obviously get to a facility where there is healthcare. Whether you're in a resort, whether that means going to the health facility there or going to the local hospital. Additionally, if you have this travel coverage or insurance of some sort, at this point you would contact that phone number. So the first thing you really need to do is, one, make sure you're safe, and then two, then you're going to call that number of the policy or whomever you bought it through so that they can take the necessary steps to begin medical evacuation plan. At this point in time, when we have policies or individuals have policies, it goes to these companies, whether it be a travel assistance company, insurance company, and they will actually call into REVA about quotes, see when we can go, what is our availability, what's the cost going to be, what all goes into it.